We're gonna start with filler first. Now, with time, you know, when these first products came out, there were very limited areas where you can use them, and now as time has gone on, we're finding more and more and more and more areas you can do it. Filler, basic areas, under eye, cheeks, nasolabial folds. You can put filler in lips. Now, some people are starting to do fillers across jaw lines. You really have to know anatomy when you start trickling into these areas because you have to avoid major blood vessels. Some people are putting filler in the temple area. The temple area, once again, you have to be careful because you have major blood vessels that you have to avoid filling because you basically are going to cause face heart attacks if you clog those blood vessels. And the area that you really never should use filler in is sort of this upper area of your forehead and at the top of your nose. The reason is there's high vasculature there, and then filler use here is associated with symptoms of going completely blind almost instantaneously as the filler is being injected. It doesn't happen to everybody. It's a very small percentage of patients, but filler here is really not a good option. And then sometimes people are using filler now to straighten out the spine of the nose. If people have little humps in their nose on their profile, it can be used there, but once again, you need to know the anatomy because you have arteries that go over the bridge of your nose, and you have to avoid that artery and not get the filler in there. The bottom line sum is fillers can be used sort of from here down, and then from here up, we avoid the fillers. And you have to be careful with fillers too, because when you get them, you don't want to do too much because you start changing the whole look of the face, and you then looking at these before and after pictures of patients and they're yucky. Then there's Botox. Botox originally was just approved for forehead, but what I have found is that it can be used in so many different places on the face. So basically Botox can be used essentially on the entire face for different things. Forehead for wrinkles, crow's feet for wrinkles, a little bit under the eye to sort of give the eye an open look. And if you're going to do it, you could put a little bit right here. It will open the eye right here. And you could put it right here and will pull your eye down. So you get an open look and then a draw down. So you can make your eye look a little bigger if you use Botox that way. You can use Botox along the sides of your nose to get wrinkles. You can use Botox around your mouth for different wrinkles. You can use Botox in the corner of your mouth to give yourself more of a permanent happy smile. You can literally clutch your whole jawline and cinch it with Botox, starting injecting it this way, and then large boluses in the neck will do really good at neck and necklines, and then also like accentuating and tightening up the jawline so it doesn't look like you have double or triple chins. So Botox can be used in so many different places now on the face, and one of the things that I really love to do is to do all of the areas of Botox on the face because it's almost like you're giving your patient a facelift. It costs a little bit, $1,500, $1,800, somewhat to that effect, that you have to do twice a year, but it's like getting a liquid facelift. If you want to learn more about these topics, you can visit our website at cinedern.com and make an appointment with one of our providers, or you can call to make an appointment at 718-491-5800.